So, hello, I'm Dr. Kaylee Usher. I'm from the University of Western Australia, and I'm the founder of the International Arthrofibrosis Association. And today's interview is about how light can be medicine and how people with arthrofibrosis can harness it. So, a quick overview of arthrofibrosis. It's known by many names, including stiff knee, frozen shoulder, adhesive capsulitis, and quite a few other names, which makes it all rather confusing. And these nicknames all overlook the pain that accompanies the stiffness in active arthrofibrosis. There is a residual form as well that generally isn't painful. So I feel that arthrofibrosis is the name that we should be using. It literally means fibrosis of a joint, and being one form of fibrosis, it shares the same fundamental pathology as all the other forms of fibrosis, and there are many of them, like heart disease, liver disease, lung disease. So we can learn a lot from how these other diseases are treated and apply it to arthrofibrosis. So arthrofibrosis is actually relatively common after a joint injury or surgery, and it can affect anyone at any age. So we don't really know if we're going to get it or not. And it can have a very severe impact on people's lives. And there are no guaranteed cures. So anything that we can do to make our joints a little bit happier is well worth doing. So today I'm exploring these topics with Dr. Seheult, and Dr. Seheult doesn't need an introduction for many people. He's the co-founder of MedCram, which is a major educator of medical professionals and also an amazing YouTube channel with over 1.5 million subscribers. And Dr. Seheult is a professor of medicine as well as a practicing pulmonologist, critical care specialist and sleep physician. So, Dr. Seheult, in your many roles as a physician, you must deal with inflammation a lot, both acute inflammation from an injury or surgery or infection, as well as longer-term chronic inflammation that can cause diseases like fibrosis. So could you give us a bit of an overview of this very complex topic? It's you're very good at explaining complex topics.
Thank you. Well, first of all, thank you very much for inviting me here, Haley. I really appreciate it. But yes, you're right. So inflammation is very complicated, and it's the result of our immune system. And I can't help but think about the 4 terms that are used to describe the aspects of inflammation, and they are rooted in the Latin words calor, dolor, rubor, and tumor. And what do those things? What do those things mean? So calor is heat, rubor is redness, tumor is growth, and dolor is, for those who know how to speak Spanish, it's the word dolor, which means pain. And so these are the 4 things that you see in inflammation. Now, inflammation is not bad at the beginning. Inflammation is actually required because it tells the body that there's an invader, there's something that is not supposed to be there. Where inflammation goes awry is when it starts to become chronic inflammation. That's when the disease state continues on and it's not resolved. What you typically want with inflammation, as anyone knows who hits their finger in the door or gets smashed, it's going to be all of those 4 things for a little while, maybe for a few days, or you've gotten stung by a bee. You'll have all of those 4 things happen very quickly. But after some period of time, it will go back down and it'll go back to normal. That doesn't happen with every single situation, because one of the side effects, and you were just talking about joint fibrosis, and one of the things that I see in my practice is also very similar, except we see not fibrosis of the joints in my pulmonary practice, we see fibrosis of the lungs, which is very disturbing and can really impact clinically how the patient breathes, because you see the lungs are like this elastic balloon. It's like a balloon that you inflate, and it's supposed to be easy to inflate. What fibrosis does is it basically makes it very difficult to inflate, number 1, so it's hard to breathe in. And number 2, it causes disruption of the cross-sectional surface area of the lung, so it destroys that. And so fibrosis in the pulmonary realm is damaging. Fibrosis in the arthritis or the articular realm is also disturbing. And unfortunately, fibrosis or the deposition of collagen, which is a protein, is the natural common final product of inflammation. And that's one of the reasons why it's important to have inflammation early, but then have that inflammation go away. And so that's kind of an overview. How all these things happen are very complicated. There are players in the immune system like cells, macrophages, neutrophils, lymphocytes, and they communicate with each other using very complicated cytokines that it might be to people hearing it for the first time, interleukins, tumor necrosis factors, interferon. And these are all areas of very intense research and study to see if we can prevent some of the downhill stream effects of inflammation to prevent fibrosis from occurring. Because the problem is that once fibrosis has occurred, it's very, very difficult, almost impossible, to reverse the effects of deposition of fibrosis.
So I believe oxidative stress is a fairly fundamental part of this inflammatory process. Can you tell us what oxidative stress is?
Yeah, very good. Oxidative stress is hard to explain unless we get down into the nitty-gritty of how the cell works. So the cells all need energy, just like a car needs an engine, okay? The car is a pretty thing to look at, but it's not going anywhere unless you have an engine in it. Same thing for the cell. All of the processes that occur in the cell need energy for them to work. And so the mitochondria is that place where this works. Now, the mitochondria has 3 fuel tanks, not just one like your engine, your regular engine has. It has fats, it can metabolize fats, it can metabolize proteins, and of course carbohydrates. And all of those things get funneled down into 2 carbon units known as acetyl-CoA. It goes through something called the Krebs cycle, where you have these highly charged electrons that are very reduced. When I say reduced there, I don't mean like lowered. I mean like they're not oxidized electrons, they're reduced electrons. So they're high energy electrons, and as they go down something called the electron transport chain, they are releasing energy in little bits, and every time they release energy in little bits, they pump protons into that space around the mitochondria, like a dam would have water behind it. And as that water comes through the dam and turns the turbine, something very similar happens in the mitochondria. The protons go through a protein pump, and that starts to make ATP. And that's, of course, the currency of energy for the cell. Sounds great, works well, no problem, right? Well, the problem is that it happens when those electrons start to lose energy and they go down their electron transport chain. Finally, the electrons become so oxidized, so low in energy, that there's only one molecule that will receive those electrons. No other molecule will receive those electrons other than the molecule oxygen. And this is where we get the term reactive oxygen species, because it takes 4 electrons to convert that oxygen molecule into a water molecule. All 4 of those electrons have to do it precisely in the right way to make a water. And it does that most of the time. But occasionally, sometimes, it doesn't do it perfectly. And the result of that is you will get something called a reactive oxygen species, or ROS. So that would be something like, for instance, a superoxide, or something like a hydrogen peroxide, or something like a hydroxy radical. These are things that can affect the proteins that are right next to them. These are species that are so reactive, they are so damaging, that they literally only have to move a matter of angstroms from where they are, and anything they interact with, they will damage it. And so, of course, because this is happening in the mitochondria, the thing that gets damaged is the mitochondria, which is not good, because you're damaging the powerhouse of your cell. And so the way I like to think about this in an analogous way is to think about the engine in your car. As you're using the engine is heating up. The very act of what the engine does can cause a product, heat, which can directly damage the engine. And so what your engine needs to remain cool and to remain active and optimized is a good cooling system. So it needs an oil pump and an oil filter, and it needs a radiator, and it needs water. So these are the sorts of systems that your body has in place to deal with reactive oxygen species. The problem, though, is that if you don't have a very good cooling system, or if your cooling system is not working, the engine starts to heat up. And as the engine starts to heat up, those pistons start to enlarge, and more damage occurs. So in other words, if you have a slight amount of damage and you don't deal with that damage could lead to more damage very quickly. And that's exactly the same thing that happens in the mitochondria. If you have oxidative stress, that oxidative stress makes the mitochondria not work as efficiently, which causes more reactive oxygen species, which causes even more damage. And believe it or not, what I'm describing to you here, reactive oxygen species and oxidative stress and damage, has been implicated in numerous diseases that are seen in the Western world. I'm talking about diseases like diabetes, dementia, heart disease, hypertension, metabolic disorders, even learning disabilities like autism. So these are all situations that can happen.
Can you tell us about myofibroblasts and how they're affected by oxidative stress and inflammation?
Yeah, so myofibroblasts are basically the forerunners or the precursors of collagen. These are the things that actually deposit and put down fibrosis and collagen fibers. And sometimes this is necessary. I mean, these are not bad cells per se. These are cells that go out and actually try to repair and structurally tie together. Imagine if you had you were on a ship and your ship had a big hole in it. You would want to patch that hole and seal it up and make sure that it was strong. If you get a cut, for instance, there's a scar that forms. That's these things that are doing this, and they also, of course, are in the joints and they cause all sorts of these things. So when you have oxidative stress, when you have these sorts of things in these kinds of cells, you're going to get these cells not working as appropriately. Maybe they won't put as much fibrosis down. Maybe they will put more fibrosis down. A very similar thing happened in COVID, where we had the oxidative stress occurring in the cells that coat the vasculature, your arteries and your veins. These are called endothelial cells. And of course, when the virus went into the blood, the virus would interact with these cells in the blood vessels. And what would happen is the oxidative stress would damage these cells so much that they would peel off the side of the walls of the blood vessels, and they would expose very thrombogenic articles and antigens, and that would cause an in situ, or basically in place, thrombosis. Okay, so depending on the cell type, here we're talking about myofibroblasts, but depending on the cell type, the oxidative stress is going to have different types of symptoms that you would see. So oxidative stress certainly is well known to occur as you get older. As we get older, we get more oxidative stress in our cells, just without COVID. Those that have COVID have more oxidative stress. Those that have some of these diseases also have more oxidative stress. And so the question that of course is begged here is, how can we mitigate, reduce, get rid of excessive oxidative stress?
And the inflammation that follows on from that as a result. Yeah.
Exactly. Yeah.
So you've talked a lot in your MedCram YouTube videos about how sunlight and near-infrared radiation can address those issues to some extent. Can you tell us in broad terms what sunlight is and what the solar spectrum is?
Yeah, boy, this is something else. So we have probably the majority of the photons that are coming from the sun. Sun basically gives out energy in the terms of photons, which are tiny particle packets of energy, and only a small amount of that, 39% of those photons that are coming from the sun, we can actually see with our eyes. There is some light. I use that term loosely because we cannot see this light. This is light that cannot be seen with the eyes. That light, there's light that is beyond the violet, known as ultraviolet light, that we cannot see. And there is maybe about 4 or 5% of the energy that comes in that form. But there's a very wide amount of energy and photons that come from the sun, about 53%, more than half, that is infrared, that is beyond the red, that we cannot see. And so obviously we all know about red, orange, yellow, green, blue, and violet. Those are the different types of colors that we can see. This is energy that's coming from the sun that is able to excite electrons into different states and have the decay back down, and we see that as color. But remember, though, that the energy in the infrared, which we'll talk about more specifically, that type of spectrum of light that we cannot see doesn't have as high enough energy as the visible light, and so it doesn't cause us to see light per se, but it has enough energy to move things around. And it can, for instance, cause heat. You can feel it sometimes as heat, but it also has another property which is very, very important. And it has the ability, more than just regular light, visible light, it has the potential to penetrate very deeply into tissues. So the analogy that I like to use is that infrared light has a longer wavelength than visible light. And it's because of that property that it's able to penetrate deeply. You'll understand this if you can recall when you're driving and somebody, you come up to a stoplight or a stop sign and someone pulls up next to you and they're blasting their radio. And maybe it's punk music or rap music. What is it that you hear? Mostly in your car or feel. You can actually feel sometimes the steering wheel vibrate, or you might feel vibration in your seat, or you'll hear very low frequencies. And the reason why that's the case is because it's primarily the low frequency sound that is able to penetrate not only the car next to you, but also your car itself. This is the same property that I'm talking about with infrared light. So infrared light, number one, you cannot see it. Number two, it can penetrate very deeply. And we'll talk a little bit more about what near infrared light can actually do. But there's a couple things that I will just say on the offset. When we're talking about the sun, the sun, as the wavelength of the light coming from the sun gets shorter, the energy goes up, but the ability to penetrate goes down. Okay, so let's look at two very extreme examples. Ultraviolet light, which has a lot of energy associated with it. There's an equation that uses Planck's constant, that energy is equal to h times the frequency of the wavelength. And so because ultraviolet light has a very high frequency, you multiply that by Planck's constant, you get a very high energy. So these photons have a lot of energy. They're able to knock off electrons. They can cause damage. And so ultraviolet damage, skin damage from the sun is a very real thing. However, they're not able to penetrate through the atmosphere as well as infrared light. And so because of that, when the sun is very low in the sky, that ultraviolet light doesn't penetrate very well. When it's wintertime in the northern hemisphere or wintertime in the southern hemisphere, okay, so or not now in the southern hemisphere, but in July, for instance, down there in Australia, when the sun is generally low in the sky, you're not going to be getting as much ultraviolet light because it can't penetrate through the atmosphere as well. Generally speaking, if you want to get ultraviolet light, you have to have the sun pretty high overhead so it can directly penetrate through the atmosphere. That is not the case with near infrared radiation. Near infrared radiation, yes, it is less when the sun is low in the sky, but there's still quite a bit of near infrared energy that you can get from the sun when the sun is rising and also when the sun is setting. And this type of energy is low energy. It does not knock off electrons. There is not ionization of energy. There's not that potential for causing cancer or skin damage with near infrared radiation. Now, one other thing I would just mention as well, one of the things that can really prevent the transmission of near infrared radiation is water vapor and clouds. And the reason is because the energy of vibration between the water molecules is at the same frequency as some of the frequencies of near infrared radiation. So what you'll see is when you look at the frequencies of light that come on this side of the atmosphere, you will see that there are some significant deficiencies at certain wavelengths, and that is because the vapor in the air has absorbed those specific wavelengths, and what we're getting here on Earth are the ones that are left over, which is the majority. But just be aware that, for instance, if you go out on a cloudy day, you're not going to get as much near infrared light as you would, for instance, on a bright and sunny day. So
Okay.
yeah.
Very interesting. Yeah. So yeah, I guess we feel the results of that by the cooling when it's cloudy.
Yes, exactly. But there's new research. We could talk about melatonin and things of that nature in terms of why why would light be so beneficial for
Yeah.
oxidative stress. Well, there's some new research that has come out, and they've been looking at this for quite a while. Dr. Russell Ryder, who is the executive editor of the journal Melatonin, and also Scott Zimmerman, who is a light engineer, co-authored a paper that was published back in 2019 looking at the optics of the human body and light. And in that article, and they summarize a lot of the research that's been done, is what they're finding out now is this substance called melatonin. Now, we're all familiar with melatonin, right? It's secreted from the pineal gland in the brain. It usually is secreted at night, right before you go to bed. And if there's any light that gets stimulated onto your eyes, it'll shut down melatonin production. So it's important that you get sleep early and that the lights are dim and dark so you get that melatonin. Well, as it turns out, that solution for having melatonin is really something that happens during the day. And why would you need this? Melatonin is probably one of the most powerful antioxidant substances known to man. It's far more powerful, for instance, than glutathione. In fact, melatonin actually upregulates glutathione. So it's sort of the king of kings when it comes to antioxidants and removing oxidative stress. But as it turns out, that system of melatonin from the pineal gland only represents about 5% of the total melatonin production in one's body. This is melatonin that is produced in the pineal gland and goes into the bloodstream and then is circulated around the body. It is believed that this melatonin that is secreted at night is not only a hormone that signals sleep, but it also goes into the cells, and it is the molecule that goes into the mitochondria and mops up these hydroxy radicals, these superoxides, these hydrogen peroxides that can damage so quickly the mitochondria. And this is the reason why it's so important that you have melatonin that does this. Now, some of you would probably go out there and start overdosing on melatonin, taking a lot of melatonin. It is a sleep hormone, so it can interfere with sleep. It can make you sleepy, and it's actually paradoxical. If you take too much of it, you can actually have deficiencies in your sleep. But the point being is that if that's only 5% of total body melatonin, where's the other 95%? And the research is starting to indicate, we don't have definitive proof of this, but it's certainly very suggestive, that near infrared radiation from the sun directly stimulates mitochondria in their place to produce on-site melatonin to mop up and to get rid of oxidative stress there on site. There is some data that shows very clearly that tryptophan, which is an amino acid that is labeled, radio-labeled, is shown to be converted into melatonin. So we know that the synthetic process is there. And we do know that, for instance, we can actually cause melatonin in the sweat of the skin to be higher on exposure to near-infrared radiation than what we measure in the blood, which means, of course, that since the sweat has a higher concentration of melatonin in the blood, it's not getting there from the blood. It's getting there. It's being produced on site. There's been a number of papers that have looked at that. And so what does this mean? This means that, in fact, the body's main mechanism for making sure that oxidative stress is kept under control during the day is actually the opposite of what it does at night. At night, it's very important that you have no light to have melatonin production. What's required during the day is exposure to sunlight. And I say sunlight very specifically and not just light, because one of the things I want to just mention here is that it's specifically near infrared light. And we don't get near infrared light nowadays from just about anything except the sun. The windows that we put in our homes seem to filter that out for economical purposes and heating and air conditioning. And also the bulbs that we put to reduce electricity usage are typically LED bulbs, which are designed to only emit in the visible spectrum because we're trying to save energy. We don't want to waste, quote unquote, waste energy by producing light that we don't see. And so this has been the issue. Now, the old incandescent light bulbs did broadcast in the near infrared, but of course we've been on a mission to replace those bulbs with LED bulbs because we want to reduce energy consumption.
So in a way, you could say our technology has outpaced our understanding, but now the research has caught up, and it's
Yes.
kind of it's showing us why we have this natural instinct to sunbathe, and why even my dog will rush out and lie in the sun at the first opportunity, because there's very real beneficial effects from that.
Yeah, Haley, this is a really important point that you bring up. For the first time in human history, humans are now being exposed to light in only a portion of the full biological spectrum. So we are now being exposed to just visible light without infrared light specifically, or ultraviolet light. And this is happening over and over and over for long periods of time. People are in buildings and they're not exposed to near infrared light. I don't know how it is in Australia. I'm sure it's not too different from us in the United States. Recent survey was done showing that 93% of our waking time is either in a house, in a dwelling, in a building, or in our car.
Highly unnatural environment.
Yep. Now, there is one
So
thing I would mention. I was going to mention one other thing. There is a very curious, interesting aspect of being outside and near infrared light. So obviously, you're getting quite a bit of near infrared radiation from the sun, no question. But there is something that can literally almost double or even triple the amount of near infrared light one receives when they're outside. And that is being surrounded by material that is highly reflective of near infrared light. And you may ask, well, what is that? And it's very well known. And you can see this for yourself if you ever look at near infrared photographs of outside. But trees, greens, leaves, grass, all of these things are extremely highly reflective of near infrared light. And it's very interesting because we have known for literally decades, research has shown that people who live in green spaces have much lower risks of disease, have much lower risks of diabetes, have much better quality of life. And again, that is tied, it's probably multifactorial, but it's interesting to me that if you were to just go onto Google and type in near infrared photographs of the outside and look at how the leaves appear in those photographs. Look at how the grass appears in those photographs. They literally look like light bulbs. They're very bright and they're white. And so not just spending time outside, but getting into green spaces outside is very important if you want to maximize near infrared exposure.
very good point. And that's kind of another natural instinct too, isn't it? To be in gardens, in green spaces. We enjoy those places. We feel good there.
Absolutely.
So it's not just about vitamin D, is it? There's been a lot of focus on vitamin D, but there's a lot more to it than that.
I'm not discounting the possibility, or even in some cases the fact that vitamin D supplementation is very helpful. Not at all. I take vitamin D myself because I do think it's beneficial. But I believe in a number of cases where we have seen an association between good health and elevated vitamin D levels, I'm convinced that in many of those cases, it could very well be that vitamin D is acting as a marker for those people who have been outside. So being outside is going to give you not only the benefits of near infrared light, which does not make vitamin D, but also the benefits of ultraviolet B radiation, which does make vitamin D. And so I would say this, I would say that getting outside is really important, that you cannot substitute going outside and just say, I'm going to take a vitamin D capsule.
Okay. So I'm curious to know if hospitals use near-infrared radiation therapy for their patients, as they can't generally get outside very much.
No, they don't. And unfortunately, it's difficult to do because most of the patients who need to go into the hospital are usually too sick to get outside. Now, I say usually. Recently, I've had a patient in the hospital, as it turns out, a patient with COVID, and was on high flow oxygen. So that when I say high flow oxygen, it was about 35 liters of oxygen per minute, and he was on 100% oxygen. And I was, I work with a great staff of nurses and respiratory therapists, and when I got them excited, they got excited, and they wanted to see if we could do this. We actually got this gentleman in a wheelchair on that high flow of oxygen outside, and it was a very sunny day. This was a few days ago, and we were able to do it. And we got him out in direct sunlight for about 20 minutes, which is the best that we can do because we don't have near infrared lamps or lights or things of that nature. And happy to say, I don't know, this is one case. It's anecdotal. I can't tell you if this actually caused it or not. But just take it for what it is. The next day, he was already down to 15 liters of oxygen on 90%, and then today down to 10 liters
Wow.
after doing that. After for a week, getting worse and worse and worse. So I can't say that that's what did it, but I'm certainly encouraged by those kinds of results. Now, there was a study group in Brazil a couple of years ago in the thick of COVID. And what they did was, based on the information that we've just talked about, they actually made a jacket. Okay, this was a jacket that was made out of LED lights on the inside. Now, these LED lights were broadcasting in the near infrared. So if the lights were turned on, you wouldn't be able to tell that they were on because you couldn't see it. So certainly you could blind very easily with this. And they put these jackets onto COVID patients that had either mild or moderate disease, that were not in the intensive care unit, not on ventilators, but they were certainly sick enough to be admitted to the hospital, and they required oxygen. And they did a randomized controlled trial. So this is randomized controlled. This is the highest level of evidence that we have. And the randomization was, did they turn the jacket on or did they turn the jacket off? And the amount of energy that was coming out was not to the degree that you would be able to feel the heat from these LED lights. It wasn't that powerful. Amazing results in this study. And we actually talked about it in our MedCram channel about an LED jacket. If anyone's interested, they can go to our MedCram channel and look at the actual study there. But it showed that there was a statistically significant difference in the mechanics of breathing. They had better tidal volumes. They had faster improvement in their oxygenation. They actually left the hospital 4 days earlier than those that had the jackets not switched on. There was no difference in mortality, but there was only about 30 patients in that study. It wasn't powered for mortality. But that's one of the studies that really got me interested in understanding about light, and has really made me motivated to get patients who are in the hospital outside. There's studies that have been shown that if you've got a hospital room with 2 beds, there's a bed by the door and there's a bed by the window. On average, the patient that is in the bed by the window gets out of the hospital earlier, statistically significantly.
That's really interesting. So do you think hospitals are starting to move in the direction of near infrared therapy or outdoor treatment? No.
I don't think so. I think this is something that we're going to really need to bring to the forefront. I think the wheels have started to turn. I think people are now understanding that if we want to have hospitals that are designed for people's health and delivery of health, that we're going to need to have a more healing and nurturing environment. And I can't help but be reminded of the types of hospitals, and I've seen pictures of this over 100 years ago, hospitals like sanitariums, where they would have patients. I've seen pictures where they have the entire ward, they would take them outside and put them in the sun. These were I've seen pictures even in England. There was a hospital that showed these young teenage girls outside in these beds, and the caption at the bottom was the orthopedic service. So these were orthopedic patients. Presumably they were having, I don't know what kind of operations they were having, but they were outside. So it was well known at the time that heliotherapy, as it was known as, was very beneficial in terms of rapidly healing and getting the types of responses that they needed to get. A lot of hospitals today, they're dark. The doors are closed, the blinds are closed, they have a television on. And what we've done is we've done a situation where people are watching TV late into the night, so suppressing melatonin, and the blinds are drawn and it's dark in the day. They lose this idea of what's day, what's night. There's beeping, there's nurses coming in at all hours, and you can become very disoriented, and you can become very confused, especially as you get older. And all of these sorts of things. You can fall, you think you're at home, you get out of bed. So I think there's much better environments that we can have for people. especially when they're in the hospital. I hope
Sure.
this catches on. I hope architects start to look at this, but it's not going to be easy or economical.
I can see a real benefit for aged care facilities incorporating it as part of their routine care as well.
Oh, totally.
Mm.
I mean, how many nursing homes have we been in where the tenants or the residents of these nursing facilities have been indoors for days on end, maybe weeks, and have not seen the sun once? I mean, getting them out. If you recall, during the pandemic, I don't know how it was for you in Australia, but the first patients that I saw in our hospital with COVID-19 was these nursing homes. They got basically cleaned out. The entire nursing home population all came down with COVID, and we basically filled up our hospital at the very beginning with all of these patients. And they were essentially sitting ducks. They were older patients with a lot of reactive oxygen species, oxidative stress, and not getting out into the sun. Retrospectively, they were the ones that were going to be the first.
Yeah, for sure. So, what health problems has near-infrared radiation been used to treat with some success?
Oh, so much. Let's talk about what everybody is. Of course, we can talk about COVID. We just did about that, but let's talk about some other things. Dementia, Alzheimer's disease, strokes. There's actually devices that are being constructed, devices that are being made as we speak that are working for FDA approval here in the United States, where they're basically helmets and with high-powered lasers that give off near-infrared light that diffuse and go into the brain to improve the activity and the energy-making process of the mitochondria in the brain. Let's think about this here for a second, because this is actually quite fascinating, and we didn't talk about this much, but we said that this light can actually penetrate through tissue. Well, you say, well, there's a skull up there. What's the shining a laser on the head if there's a skull? Well, for those who are in the medical field will know that one of the ways that we have of checking to see if the sinuses are full of pus or fluid is to transilluminate with a bright light. We do this all the time, actually. And you can put a bright light on the frontal sinus, and you can see whether it transilluminates in the dark, or you can put a light on the maxillary sinus and look in the roof of the mouth to see if there's light that's glowing on the roof of the mouth. And what is this telling you? It's telling you that light can penetrate not only skin, but also bone, illuminate, and then come back out again through bone and skin. And this is visible light, right? We're not even talking about near infrared light, which has a much greater capability of going through that. Now, there's a astrophysicist in the UK in Bath by the name of Robert Fosbury, who sent me a great photo. He also is involved with this kind of work. And he showed his hand basically with a near infrared light source behind it, and he took a photograph of that. And what's amazing about this photograph is that you don't see the typical light coming through with the skeleton of the bones. All you see is light coming through this hand, and some of the blood vessels are absorbing it because there are substances in your blood that can absorb near infrared light. But the point is that the near infrared light, now this is really important to understand, near infrared light bounces off of things and scatters and can go for up to centimeters. So in other words, infrared light can basically, when it hits our body, it scatters in multiple random directions and marches for up to 8 centimeters. Okay, so that's what's happening now. Imagine now this light is coming down onto your skull. And this was all printed up, by the way, in Russell Ryder's and Scott Zimmerman's co-authored paper that was published in Melatonin Research back in 2019. When the light penetrates through the skull, the next layer that it gets to is a whole layer of cerebral spinal fluid that surrounds the brain. That fluid, that liquid, which is mostly water, basically diffuses that light all throughout. So the first thing in your mind is, okay, you're putting lasers to penetrate through the skull. How do you know you're hitting the right area? It doesn't matter, because the cerebral spinal fluid is going to diffuse that light all the way around the entire brain. It's almost like there is complete internal reflection. And so that light is going to is going to basically illuminate the cerebral spinal fluid. Now, think about this, because the folds called sulci and gyri on the brain surface of the brain, they basically collect this light, and then because as it goes down, it reflects and allows that light to bounce down into the deepest crevices of those sulci. And you know what lines the entire surface of the brain? Gray matter. Do you know what's in gray matter? Cell bodies. Do you know what's in cell bodies? Mitochondria. So here's the amazing thing about this, is that you basically have this near infrared capture mechanism called your skull, and the cerebral spinal fluid, which collects this near infrared light, and then the brain is able to evenly distribute this near infrared light to keep cool, to keep well oiled, if you will, the mitochondria, which are extremely important in the brain. So you asked the question at the beginning, is what else has this been used for? There's been multiple studies that have shown that the more somebody is out in the sun, the less Alzheimer's disease that they have. That whole brain volume, gray brain volume, is associated with sun exposure. That multiple sclerosis, you should know this very clearly, that multiple sclerosis is a disease that is associated with latitude. So in other words, the higher in latitude you are in the northern hemisphere, or the lower in latitude you are in the southern hemisphere, in other words, the closer to the poles that you are, the more likely you are to get multiple sclerosis. And that people typically often move to lower latitudes if they want to try to get better. I personally was born in Canada, and I remember growing up in elementary school, we always had fundraisers for research on multiple sclerosis. That was something they were always doing, is multiple sclerosis, and then I moved to California, where I am now, and I didn't hear about multiple sclerosis at all. Hardly anybody actually has that. It's not a disease that we see that often in Southern California. Again, there was a study that was done in Great Britain at Oxford, and also in Leiden, the Netherlands. These are two cities that both participated in this study. And what they did was they basically were looking at diabetes, cholesterol, and metabolic syndrome, and they had them draw blood. Okay, so they went to the lab and they drew blood, just like we always do whenever we're about to see the doctor, right? Fasting blood glucose. Okay. And so what they did was they looked at the date that people submitted the blood sample in both cities. They didn't compare these two cities. They just put them all together, and they looked and they said, let's look at the forecast, the weather forecast for the previous 7 days, just 7 days. Okay. I want to give you an idea about how quickly this stuff can actually start to work. So the previous 7 days before they took the blood test, they found that when they looked at the weather forecast for the previous 7 days, actually it wasn't a forecast, it was actually a weather report because it actually happened. They found that the more sun in each of those days that there were predicted the severity of the metabolic syndrome. In other words, the more sun there was in the previous 7 days, the better their metabolic profile was for diabetes, the better their metabolic profile was for cholesterol, the better their metabolic profile was for triglycerides. So what kind of diseases are we talking about? We're talking about diseases of the metabolic syndrome. We're talking about diseases of the brain. We're talking about all of those diseases that we talked about at the beginning that are related to oxidative stress in the mitochondria. What were they again? Diabetes, cancer even, dementia, learning disorders, autism. These things have all been tied to malfunctioning mitochondria.
And I'm thinking also anxiety and depression, which are kind of become the modern epidemics.
Yeah, so even when we're talking about depression, there's a whole other pathway for that. So we've talked about how light can enter into the eyes and will stimulate the conductor of our circadian rhythm called the suprachiasmatic nucleus. Well, there's another portion of the brain that it goes to called the perihabenular nucleus. Okay, say that 5 times fast. The perihabenular nucleus. Okay, and we know that that portion of the brain needs stimulation, and if it doesn't get enough stimulation, people become depressed. And we've seen this. About 5% of the world's population, typically women, but also men, can get something called seasonal affective disorder. So when it becomes in the wintertime, you don't get enough sunlight, can become depressed. Well, there's a very simple solution to that. It's getting a 10,000 lux light box. You can get it on the internet for about $20 US. I don't know how much that is in Australian, but not that expensive at all. And if you set up this light box, 10,000 lux light box, and put it about 11 to 15 inches in front of your face every day in the morning for about 20 minutes, you can almost completely eliminate the effect of low light in the wintertime and basically cure seasonal affective disorder. So what are you doing? You're basically stimulating the perihabenular nucleus, and it's wonderful.
Amazing how our bodies have really evolved to be outdoors.
Well, I think that's the way it was intended. Yeah.
I'm curious, can near-infrared radiation therapy help to reduce pain?
Good question. I don't know of any particular studies that have actually looked at the reduction of pain from near-infrared. However, there is studies and research that is looking at infrared light and its ability to stimulate nitric oxide locally and increase blood flow. Now, sometimes we don't like to have increased blood flow because that may cause more pain, more calor, rubor, dolor, and tumor. But to the degree that the issue gets fixed faster and the chronic inflammation goes away, that might be of benefit. I'm sure there has been some looking at near infrared. I'm just not up to date on those studies.